Good afternoon. I'm Brent Rusin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report.
A remarkable run for the province continuing as Monday brought 13 straight days with no new COVID cases, while the number of detected active cases is just one. These numbers are incredible, but our province's top doctor says complacency can lead to this run ending right quick.
We're seeing less attention paid, at least in certain areas, to the need to physically distance, and probably a lot of that has to do with people losing sight of the virus. But that's why we want to remind Manitobans you don't have to look very far in other jurisdictions to see what can happen.
But for now, Dr. Rusin does say the low caseload means we can continue to look at loosening some restrictions, something he hinted may be on the way, just in time for something we've all been waiting for, playoff hockey.
We're looking at probably soon to even relax those outdoor gatherings even further. So I think there's probably a possibility of having a decent sized gathering for these events.
With the expected first wave of COVID now crushed, our province's health system appears to be sitting in really solid shape ahead of the expected wave 2 this fall.
The ICU right now, the occupancy rate is less than 75%. The overall bed usage in the Winnipeg hospitals is below 80% occupancy, and outside of Winnipeg, it's below 70%.
With almost no one to trace, the contact tracing team has, for the most part, been reassigned, while low COVID numbers has also allowed Siragusa and her team to not simply react, but to be ready for COVID's inevitable return.
We will continue to plan for higher volumes, more activity, and surge capacity in the coming months.
Siragusa confirming a new respiratory infection unit has been established with an eye on the fall, with one of their focuses on ensuring more folks do get their flu shots this year. In Winnipeg, Jonas Gilbart, City News.